Hi, my name is Raina Meyer. I use she, her pronouns, and thank you for joining the Center for Justice and Law's Spotlight Conversation series, where we talk about topics on health, justice, and law with guests. I'm a student coordinator for the CJL at Hamlin. This is our conversation around the topic of immigrant and refugee health to coincide with this year's theme. And our conversation today will be with Amina Dedefo. Amina, thank you so much for joining us.
Of course. Thank you so much for having me. I'm honored to be here.
Well, we are so honored to have you. I've asked you to join me today because you are such an incredible, fearless leader. And I love talking to you just about everything under the sun when we get into those those conversations where just talking about all the complications that surround our world, especially politically. And you inspire me because you are an incredible leader. I look up to you a lot, especially in an organization we both work in, MyDFL. It's really been amazing to see you lead the charge on so many important progressive issues. So I really appreciate you.
I feel the same about you. I love that we get to work together and also get to rant together. So it's a blessing to have people, especially young people, understand the political climate and are willing and are able to do the work to ensure that, we create an inclusive environment for all.
Absolutely. Yeah, and kind of like tying into that, could you tell us a little bit about the work that you do for your community?
Yes. So I myself currently work for the city of Minneapolis as a policy associate, but on a daily basis, I would consider myself a community organizer, um, just an organizer of many sorts when it comes to politics, issues, campaigns, rallying around issues that really impact immigrants, young people, people of color, or any marginalized groups. Just because I relate to those things and my family as well. So that really impacts me, and just making sure, that we fight for other people as well and that they have the same rights as anyone else in America.
Yeah,
That's the kind of work I do.
Yeah, and we're really lucky to have you doing that work. Yeah, and you've already you touched on this a little bit, but how does the specific issues you've taken on, the advocacy you've done, connect to the CJL's theme this year of immigrant and refugee health, justice, and law?
Good question. So I wasn't born here. I'm an immigrant. I consider myself an immigrant, but also an American as well. And so when we really consider the issue of immigration and such, just because I understand what it took for my family to get here and the process, how long it was, I feel like sometimes there isn't justice in these processes. So immigration and justice, I feel like those two are right there. And also because of just the political climate in these other countries and the involvement of Western powers in these countries that people have to flee and refugees come here in hopes of the American dream, which often it's not achievable for all, but it's still, there is a dream that can be achieved if, we have laws in place that ensure that all people are treated equally and fair, in which we as a country have a lot to do to ensure that. But I hope that kind of answers your question or gives way to the issues that I talked about.
Yeah, no, absolutely. I feel like our series so far has touched on a lot of the themes that tie into the concept of the American dream. And kind of diving deeper into that, what do you see as specific barriers that immigrants especially face in terms of health when they're trying to access that dream?
Did you say health?
Yeah.
Yeah. So I feel like, especially in America, it's really hard to have access to healthcare unless you are receiving health insurance through your work or through the state. Or even if you don't know how to get it through the state, most immigrants, which when they come or when they arrive to America or come from any countries, they don't know that these resources are available to them unless they go out and seek them. And in order to do that, you need to speak English. You need to know who to go to. And most often that's not available for them. So they don't even know that these resources are out there and they don't have access to them. And on the other hand, for people who do have access to them, it's really hard to even get prescriptions because of how priced they are in America when you look at big pharma. For example, insulin, when we compare the prices here in Canada, it's drastically different. And the reason is because of big pharmas. And so I feel like things would be a little better if our politician or legislative and lawmakers took on big pharma just to ensure that, regular everyday Americans can afford these prices for their prescriptions, which are sometimes lifesavers and they need them.
Yeah, no, absolutely. The issue of big pharma is huge.
Yeah.
Yeah, and I feel like it's harder to know about specific resources, like if you're not, if you have language barriers or if you haven't like been here for your whole life.
Yeah, 100%. Yeah. And I know, like, at the city, we try really hard to ensure that these resources are available to communities by hiring people from those communities. But oftentimes, there's still lack of access because not everyone knows it. And so it's kind of hard to ensure, that you meet the needs of so many people when you don't even know their needs. And so to go about that, I feel like, especially just seeing the process of it, I feel like hiring more people of color, but especially people from these communities to ensure that these people know where they're going, and hiring well qualified people who are actually doing the work, which sometimes it's not happening, I've realized.
Yeah. Well, I guess that that's a really good reason, it's a really good thing that we have you in there to like help people connect them to resources. And like what do you draw on like from your own identity and experiences to like help other people navigate those systems that you talked about?
So yeah, that's again good question. So fortunately, I feel like me having grown up here since I was a little kid or young person, I feel like I've had people always help me along the way to get resources or have access to things I needed in order to succeed. And so I look back at those people and just realize how if I didn't have those people to help me navigate things, I wouldn't be where I am today. Sometimes it's literally who you know and what instead of what you know. And so I feel like that's why I take my job wholeheartedly, just because I've had people lead me along the way to be here. So I want to do the same for others, give them access to the resources they need. What if I can't, who can they go to get these resources? It's just being able to talk to people, listen to their needs, and provide them an actual good answer or resource sometimes if they need it too.
Yeah, I feel like that's like that segues really well into one of the other questions I had, which is, are there any like organizations or resources that you can like think of that to share with our audience that you've like helped connect people to, or that from your like your own experience that could help with maintaining one's health?
I would say when it comes to help, the city has huge resources. So just if you, for example, we have a health department at the city of Minneapolis, and if it's an issue relating to health, even if it's just, cost of prescriptions or something, go to these people. They have resources, unlimited amount of resources. And I kid you not, I don't know how they do it, but they will find a way to help you. And so I would just say the first step is actually saying, hey, I need help. Who can I go to for this? And obviously, they're there to help you. And being a city resource, you're there for the people of this city. And so each city has, obviously, a council or city hall. Go to those city halls and ask what you need. If you can't do it, have somebody help you. There's always resources. And so I feel like most people don't even know what city council is. And so I feel like just go out of your way. I know it's hard because it's not really easy to ask for help either. But if you need it, sometimes you just have to be like, you know what, I'm down now. I just need to go to these people, see what they can do, and then go from there. But yeah, the biggest resource is your city hall, whichever city you're in. there's one, go to them. They have departments for everything, you know, public transportation, public works, healthcare, again, immigration, everything. Each department has their own set of resources and funding, which are set aside to help their constituents, meaning their people or people who live in these cities.
Yeah, that's really helpful because you're right. I feel like when people think about who can solve like very individual issues, they don't really think of their council member.
No, but yeah, I've seen them solve pretty big issues. So I'm like, they have power and most of your taxes goes to them. So you are paying for what you're asking them to do. So I feel like even just asking them, know that this is coming out of your paycheck in a way. So go to them, ask for resources. They will help you. That is one thing. And they answer every email, phone call. So there's no way they will miss you. And if you can't speak the language, just say, I need a person that speaks this language on the voicemail or something, and they will get back to you.
Very good to know. Yeah, that we've also talked a lot about like language barriers. So that is, do they have like translators at the ready for all sorts of languages?
Almost, yes. I say almost because oftentimes, even if we don't have it at the city, we have companies that we work with that can provide these specific languages. So yes, they're all available, any and all language. We will find somebody to translate. And another thing is the city also offers broadcasting systems or like TV shows and I think some radio channels for specific languages. I know we have one for Somali and Hmong and Spanish, which are broadcasted to these specific languages, and you can listen to them, and that's where they talk about the city resources, just things that are going on in the city, updates, laws, policy, everything. So that's kind of one way to get updated. But again, yeah, language barrier, if that's your issue, just leave a voicemail and say, I speak this language, or say your language and translator, and they will find somebody to help you. But the first step is saying, I need help, or I need somebody to help me get through this process.
Yeah, absolutely. That's really good to know because I feel like if you know that there are resources to help you, it's going to be easier to ask for help.
Exactly. And if you don't, the job of city council members are to know these resources. Even if you don't know them, they have access to them. If there's something that you need, even with immigration, you know, sometimes you can get a lawyer for free to help you, and you just have to reach out to your council member, and they know other agencies that offer it, meaning they can connect you. So that's just another way that your city council member is just responsible to you. And again, if you live in these wards, just reach out to them, email and call, one of those.
Very good to know. I'm sure our viewers will really appreciate hearing this.
So yeah, and I'm a resource too. So if you live in the city of Minneapolis.
No, that is really good to know. And kind of like I feel like you've been speaking in really like kind of intersectional terms, like talking about if you need help with immigration or healthcare or anything, like what do you see as issues that intersect with like immigrant health, especially? Like we've had past guests talk about how climate change really impacts like communities with large populations of people of color and immigrants. Like what do you see as big issues that factor into immigrant health?
I think, you know, at least from my experience, what I noticed is oftentimes immigrants don't even know, like when it comes to health specifically, they don't know that all these medications or things are available for illnesses, or sometimes they don't even know what illnesses are. Like, for example, you can tell, we'll just use cancer as an example, but when you tell, if they have no prior knowledge of it, if you tell somebody they have cancer, they have no idea what that means. They have no idea what the consequences of that, or even detecting it earlier, you know, in the stages versus later on. And so I think there's a huge lack of knowledge, and that means when it comes to illnesses, when it comes to just making sure you get these yearly checkups. That's another way to detect illnesses early on. And most times immigrant communities don't know that because they're so caught up in their everyday lives of taking care of their kids and just working on other things they need to survive, that they forget that their health is also a huge priority. And it's not their fault either. It's they don't understand the reasons of just yearly checkups, for example. I didn't either. I used to think, I don't need it. I'm pretty healthy, but it's not just about being healthy. Sometimes there are illnesses, there are issues that, you don't know that are going on. It doesn't have to always be physical and visible in front of your face to know that there's something wrong. So I think I feel like there should be more dialogue around these issues, just talking to immigrant communities when it comes to health and just letting them know the resources that are there for them to get help. And also another thing is, I think many immigrants who don't have insurance, or for example, undocumented communities, they can't have healthcare. They don't have access to free healthcare. So most times they don't go to the hospitals because they're afraid of getting caught, and then they end up with these illnesses, and then, some unfortunately die because they have no one to treat it, or they can't afford it because healthcare is expensive in America. And even, yeah, I've seen, I've worked with many communities, and there are stories that I've heard, and it's unfortunate that our healthcare system is like this, but that's why we need people who are actually dedicated to this issue to take it on and solve it faster than we've been working on so far.
Absolutely. Yeah. Everything that you spoke on is so, so important. And we definitely need policy action on this because people are dying.
Yes, people are dying. Lives are being taken. And human life at that too.
Yeah, absolutely. And we've been focusing specifically on like the Center for Justice and Law has been focusing on like how colorism and like harmful skin lightening methods like impacts specifically like immigrant populations, people of color as a whole. And I'm curious, like, how do you perceive colorism in your community, especially as a Black woman?
Yeah. So I perceive it two ways. I'm Ethiopian, but Oromo specifically. And so within my community, actually dark skin is desired. It's called Magala. And so like, it's beautiful, but as Western power and Western media has come in, the narrative has been changing, now lighter skin is desirable. And I think ultimately it has to do with, Western media. Everything is connected to this Western media, and even in other countries, India, China, South Korea. When you look at these countries, they make products, they make injections to ensure that your skin is lighter. In China, people hide from the sun, literally hide from the sun, so they don't get their skin any lighter or any darker. And so I think when it comes to combating, I guess, or even discussing this issue, I feel like people of all backgrounds who deal with this issue from all countries need to be at the table, and influencers, people with big names who ultimately have, fallen into social pressure and have lightened their skin and talk about just their process. Because think about it, if we like little Kim, I don't know if you know her, I know she went through skin lightening, her skin is completely different. And so, and it's really hard because if someone's changing themselves to be accepted by society, do you blame the person or do you blame the society you're in? Because they're doing it just to fit in and be liked because you're telling them they're not good enough. But now that they've made themselves good enough, you're telling them, oh, they changed. So now they're not acceptable. So it's a really hard issue to take on without having everyone at the table, and especially for young people, because they think now that idols that they've looked up to are doing it, so it's okay. but they don't realize the consequences it has on you. You can get skin cancer, you can die from this. And if you don't go to the proper individuals who have degrees or are certified in these areas, you can do harm to yourself that is irreversible. And so it's a really hard issue to take on, but I feel like what's helped me, it's just, I think as you get older and you get wiser and it's hard, but you have to realize that you are good enough, you are beautiful, and changing yourself isn't gonna change that, And so it's an internal battle you have to take on, but you will get through it.
Yeah, thank you so much for talking about like, oh my gosh, that just I didn't know hardly anything about everything that you just said, and I feel like our viewers will really appreciate it. So
Good, yeah.
touching on all of that, yeah.
Yeah, the issue of skin lightening, it's everywhere in every country and goes back to Western powers again.
Yeah, I mean, hearing that like where you come from in Ethiopia, that like darker skin is more desired, and then looking at how like that's like one region of the world, and then like the West has just totally reached over like to all of these other countries, and now that's the ideal.
Yeah, it's crazy because like before, if you look at it, it's like dark skin, everything, it's beautiful. And not to say now it's not beautiful either, but like when you look at things have changed, and that's just the reality of it. And that's the reach of other countries' power or influence.
Yeah. Well, and it also like I feel like there's so much money to be made off of like capitalizing off of insecurities in general, but like projecting like Western ideals and telling, people that they have to change everything about themselves like to fit this Hollywood standard, like skin, it's skin.
No, but I don't know the exact number, but it's a billion. How many billions of dollars are in just the skincare? And so when you look at that, people who have stakes in these, they themselves don't even use some of these products that they sell because they know the harm they cause. And so for them, it's about profit. They take the money, and these people already have insecurities. You make money off their insecurities and tell them that this product will make them beautiful, and you just keep selling it to them because it's a never ending battle again to feel beautiful and secure in yourself. And it's okay to say I have a bad day, it's okay to be down, and just trick your mind into just saying I'm gonna have a good day, I'm beautiful. It's really hard, but you can do it.
Yeah, I love that. Yeah, and it's really interesting too, because like on one side of the spectrum, you have like your skin has to be lighter to be beautiful. And then in the US, there's a lot of fair skinned people who spend hours in tanning beds and tanning lotions, and that's a whole nother industry.
Exactly. I know it's kind of crazy too, because you would think, because like now blackfishing is a thing, whiter people who are white who have lighter skin are getting tans and prescriptions and medicine and things just to make themselves darker, but not dark enough, just like a little darker. So there's a specific skin color that's beautiful, not all colors. So it's a really hard issue, just because if you want to take it on, you have to take on the whole beauty industry, instead of why don't these beauty companies, why don't they make products for your skin to heal if you have scars and such, versus covering them, why don't they make things like that? Why, if you have scars, if you have pimples, why aren't there products to make them better instead of hide them? And so again, by hiding them, when you see them again, you're insecure, the flaws that you have come back. But if you have products that actually fix these things, then maybe people can see themselves differently. But products like that are either super super expensive, or you have to get them prescribed, or you have to go to different countries. They're not available like the rest of the products that are not good for you.
Yeah.
Yeah.
Well, because you can't make an affordable option that will stop the problem, because then there's no more money to be made.
Exactly. If you solve the problem, how am I going to profit, you know?
Yep.
Yeah.
Well, so much of what you talked about can be summed up in that one sentence too.
Yeah.
If
Yeah.
I solve this problem, how can I keep making money?
Exactly. And like obviously I don't know if this is true, but like, you know, there are people who say there are cures to cancer, but if we solve the issue of cancer, donations are going to stop because so much money comes in for cancer researches, and they're like, people are going to give. So we can't say we've solved it. We'll just say there's another type. And I'm like, I don't know, but interesting.
Yeah, I mean, whether or not that's true, I've heard that too. Like the fact that so many people
Yeah.
think that the world is like that cruel to like
Yeah.
think that that might even be a possibility, I feel like is really telling.
Yeah, same thing. I think I read this again. This is not verified as well, but like there was a kid, I think I read this on Reddit. There was a kid who was in medical school, and I think on the first day, the doctor asked him, you know, if this person was sick and they came to you, what would you do, or something like that. And he was like, give them medicine to heal them, or like give them the right proper care, something. He said he would give them the thing that they needed to fix whatever issue they had. But he was wrong because he's a doctor, and in order for him to make money, people need to be sick and not feel better. So he was like, you can't give him, I guess, the proper medicine or thing he needed, something like that. So I was like, interesting again. So you're telling me if I go to the doctor, and some people actually believe this, so they fear going to the doctors because they're like, what if I don't receive the proper health care I need because they're there for profit? When everything is there for profit, it becomes really hard to trust people and think they're giving you the proper care you need as well. So I can kind of see it.
No, that's such a good point. It's hard to trust anything if,
Exactly.
yeah. Oh, we could talk about this for ages.
Exactly. It's yeah, we can.
Yeah. I guess like if you could leave this conversation with like one anecdote or message about this topic or about like anything we've talked about so far, that could like stick with the audience, what would you say?
I think with anything, it's ask people around you for help. People are, you know, some people are not nice, but you will find people who genuinely care and want nothing back and are just willing to help you. So whether, you know, it can be a job, it can be finding access to healthcare, finding a lawyer, finding, you know, someone to help you with paperwork, anything. Just ask people for help or ask people to direct you to these resources, and they will. If not, go to your city resources and just ask, because oftentimes I feel like big issues arise when you don't seek the help that you need. And so no matter how little, if you need help with something and you don't have family members that can help you or friends, go to these places. They are there. And also your school, if you're in school, they have resources. So I think that's one thing I would say, because that's something I didn't do, but like I'm realizing now that like these things are available to you and you can utilize them, whether you're young, old. There are resources for all of us. And so I feel like just knowing you have access to them and going and using them, because the city is funded by you. And if you don't utilize the resources, they just sit there, you know? And like we get funding for these things again that I mentioned earlier, whether that's the immigration services, our public works, our transportation, all these, they are funded by normal, everyday working class people, and in turn are there to help you. And if you don't reuse the resources, the money just sits there and it's wasted. So I feel like just going out, saying I need help, just even if you don't know what you need help with, say your issue and there will be someone to help you. And I'm here as a resource as well. But yeah, that would be my little anecdote.
I think it's a great anecdote, and hindsight is 2020. So I love that you're using like your past like hesitation to ask for help to let people know that it's okay. That's
Yeah, it really is okay. And like, I'm also one of those people that's like, I can do it myself. I don't need others. But I'm like, why suffer? Why go through that hard stuff by myself when I know there are people? And like, also as a person of color, it's really hard to like trust other people to genuinely help you. But there are some good people out there. Again, I know it's hard. Not everyone is nice, but there are good people who will help you. And I think taking if you get a no, don't take that as a no forever. Just go to someone else. There are people, and so many people who do this work that genuinely care and are doing it for nothing. Sometimes there are people who do this work for free. And, you know, when we think about my DFL, and that's just youth turnout and organizing in the political realm, we do it for free. We don't get anything in return. And so people like us exist, young, old, and so just willingness to ask, I think is, yeah, and being kind to yourself and just giving yourself grace and other people grace as well. I would say that's also a huge thing, especially considering we just survived a world pandemic.
Yeah, absolutely. Very, very timely messages.
So those are mine. Again, and thank you so much for letting me be a part of this. I was really excited, and I hope whatever I've said helps other people. And again, they can reach out to me as well. But besides that, yeah, I would say that's it.
Oh my gosh. Well, thank you so much for being here. We're so glad that you said yes and we're willing to share so much insight. So thank you so much, Amina. It's been wonderful to chat with you and have you on. And I'm sure that your advice and your stories and your passion really inspired and helped other people. So thank you.
Thank you so much. I hope so too. And I hope they get to know you more and how awesome you are and all the incredible things that you're involved in, not just my DFL, you're in school, you're doing so many other things. And so I think now that I'm becoming older, I think young people like you deserve the recognition for leading this change.
Oh, that's so kind.
I
Amina's
truly
not as old as she's making herself sound, by the way. She's just a couple years older than me and she's still rocking it. So, yeah.
okay.
Well, thank you again, Amina, so much. And to our amazing viewers, thank you all for tuning in. And be sure to follow us on Instagram and Facebook. Our handle is HUCJL. And tune into our upcoming event on December 3rd, which focuses on skin lightening and colorism. You can register on our social media pages. And thank you all again for tuning in.
Thank you, Raina. Have a good one.
Thanks, Amina.